In the morning, you heard several DeepTech talks on computer science, but now we will switch the gear, DeepTech on nanotechnology, right? That's the first statement. The second statement is that in the next 30 minutes or so, I will walk you through a few stories, exciting stories. I hope the stories will be so compelling that it will sort of entice you to come and visit this Center for Nanoscience and Engineering at IISc. As you know, IISc has more than 100 years of history, but Center for Nanoscience and Engineering perhaps is the youngest department that we have created at IISc. And the way this department has come about itself is a very interesting story. And why did we create this department? And in the last just 4-5 years, what is the outcome of creating this department, right? Those are the stories that I want to sort of tell you. Yes, it has come up now. Just wait for a second. And a colleague of mine started sort of brainstorming that, what would be the next inflection point in technology, right? And it was very clear to us at that time that nanotech will be the defining technology in the several decades to come, right? My background is electronics and my colleague was from mechanical engineering. So this was in itself very unique in an academic environment that two people, two faculty who are completely sort of disconnected from two different departments, they could come together and really start thinking about a common vision, right? And I would also argue that this was a very interesting experience and experiment in which it was entirely a bottoms up effort, not a top down effort. Typically, what happens is a head of the institute or a government, a minister will say, hey, we need to do this. And everybody will align to do that. That's a top down approach. But this was a case where, we started sort of thinking about it and we started building team. And that eventually led to, sort of creating this department. And this department, since it is very new, it has no baggage, right? And in fact, I wish the gentleman who asked a question to Chris was here. I'm not sure whether he's here. I will also try and dispel several myths towards the end of my talk. Unfortunately, it is still taking time to come up. The technology can fall through the crack at any time. Yeah. So, what happened? Okay. As I was telling you, the dream was to really create a state-of-the-art facility, okay? Because if you want to do research in technology, research leading to products, right? That is what we are talking about. Research not for the sake of research, right? Then you really need to have state-of-the-art infrastructure, right? So that was our first challenge to surmount, right? And it would also require substantial funding, unlike, for instance, if you're creating a new software, which may not require a major infrastructure, right? So it was very difficult because it was a bottoms-up approach to convince policymakers that this is indeed required for the country, right? But you need to be persistent. That is one more message I want to convey to you through this talk, that we were very persistent and we would not take no as an answer, right? We would go from pillar to post, and eventually we could knock at the doors of the principal scientific advisor to the government of India, Dr. Chidambaram, at what was then called Center of Excellence in Nanoelectronics at Indian Institute of Science, with a funding of 50 crores, right? But that was an important turning point. That was perhaps the first of its kind program in any academic institute in the country where such big funding was given, right? And what we could do at IISc is really sort of have cascade of events, to convince the institute administration. Can you now switch? It has come up now. That this whole initiative must be anchored in a new department, and that is how we we created this new department called Center for Nanoscience and Engineering, right? And this came into existence in year 2010, right? And great, finally, right? So, right. So what we have at this time, I've just sort of told you about some of the timeline. Um, that led to a series of events, as I just mentioned. And this Center for Nanoscience and Engineering was born with, a cumulative funding till date about 300 crores. This is the first product, right? This is no less than any entrepreneurial effort that you would see. How big it was? It attracted none other than the Honorable Prime Minister, Mr. Modi, right? So he came to this center last year and formally dedicated this center to the nation. Why were we doing that? There was a big vision and big picture, right? This started, as I said, in 2000. And in 2012, Government of India adopted the national policy on electronics. What was the trigger? You see, the trigger was that a realization by 2020 our electronics import bill will far exceed the oil import bill. And where are we in electronics, right? I mean, look at the world electronics market, which is comparable to Indian GDP, and our contribution is minuscule, nothing really, right? So to address this need, the Government of India adopted this policy, but we were working towards it 10 years before that, right? We have ambitious goals to achieve, right? But let me back off and tell you what is nanoelectronics. This is a new frontier and this is a new opportunity for us. We have missed so many buses in the past, microelectronics bus and so on and so forth. Nanoelectronics is not doing business as usual. It's completely different, right? Of course, Moore's law will drive this electronics in future, but there are going to be two different vectors. One what we call traditional scaling, and the other one what we call an equivalent scaling, right? In traditional scaling, compute and memory systems will continue to drive the technology. In equivalent scaling, lot of sensors. IoT will not exist if you don't have sensors. Sensors, sensors, and sensors. This can happen only if you have nanomaterials and nanosensors and nano devices built on that, right? So this is where we are leading to, right? And as I told you, what we really have today is a facility. This is just part of the facility. As I said, benchmarked against the best in the world. It's a pride of the country. As I said, it will perhaps compel you to come and visit this facility. There are only about 4 or 5 such facilities anywhere in the world, right? And we did not want to cut any corners when we created this facility, right? And this is a state of, in the university setting, perhaps this is the best in the world. We have an open challenge for our students. Find any facility which is better than this, we will fund your study there. That's the open challenge that we have, right? So, and we look at a whole suite of technologies, whole different kinds of nanotechnology in these facilities, right? From materials to biosensors to microfluidics or nanofluidics, photonics, what have you, right? And this is an amazing platform that is out there, right? And why did we do that? Again, I'll come back to that, right? Skill development, if you need to create products, you need to have the right manpower, otherwise you can't do anything. Then, having got the skilled manpower, you need to develop product and eventually manufacturing perhaps, right? Now, skill development, what we said, we are creating this facility which is a national facility. Of course, we will train a lot of students in IISc, but for a country like India, it is insignificant. Right from the inception, that is why it is very unique. It's a democratization of research infrastructure that we embarked on. We said, we will run a national network program, which is now called Indian Nanoelectronics Users Program, which brings researchers from all over the country, not just from academia, from industry. Now this has also been extended to neighboring countries and other countries as well. So they can come, get trained in this high-tech area and pursue their research and create devices for tomorrow, right? So that is the manpower development and the skill development. Then, you need to create products. How do you create products? We said we will adopt 2 strategies. one strategy is to co-develop products, work with stakeholders, for instance, strategic sectors, right? ISRO, Department of Atomic Energy, right? These are some of the devices which were conceived, designed, produced in this facility and are being deployed for the use of all these sectors, right? Even if you want to buy this device from abroad, you cannot buy because these are all restricted devices. How did we do that? By co-developing, right? You know, whether it is industry or strategic sectors, they are at one end of spectrum, academia is at other end of spectrum. This is known. But both have to move from their known positions. Only then there is a meeting ground, right? And that is what we are doing in this facility. Industry, right? You know, we have an interesting program called Industry Affiliate Membership Program. There are several companies who are members of this facility. You know, they are part of our life, you know, our everyday life. They sort of interact with us, and that leads to co-development of new devices, new technologies. This is just one example with Unilever. They wanted one application for malodor detection, specifically for sensing hydrogen sulfide gas, right? We started working on it for last 2 years, and now we have a product which Unilever will like to commercialize, right? So this is one more example, right? And there was a lot of discussion on IoT, and we are now starting a very unique initiative with an industry pull, right? Not just academician looking at a blue sky research. This is an industry pulled research where we want to build a whole range of sensors to enable IoT infrastructure, right? So this is co-developing, working along with industries and strategic sectors, right? Is that sufficient? No, it is not. Look at the ecosystem. Somebody was talking about Silicon Valley. What drives that ecosystem? What fuels that ecosystem? It's startups, you see. Startup culture is extremely important. We have a very unique program to have lot of startups created in nanotechnology. Already there are 4 startups which have come out of this center. I will give you one example because I am personally involved in that. But now we are setting up an incubation center in nanotechnology in this department, right? So that is how we are committed, right? It is not research for just sake of research. So one very important example, we keep saying that we have never done silicon manufacturing, right? We always repent, you know, where are the foundries? Government of India tried a lot. They came up with special incentive program. Nothing happened. There was a big buzz that 2 mega fabs will come. What we have been recommending the government is that don't look at silicon CMOS. This is done deal. Look at tomorrow's electronics. What is tomorrow's electronics? Sensors is one thing that I talked about. New materials. Gallium nitride is a big new frontier electronics area. So we said we will show that this can be done, and we started developing gallium nitride material in this facility. Gallium nitride grown on silicon so that the cost is extremely low. Not the gallium nitride wafer. You don't even get those wafers. We didn't stop there. We created devices, right? Didn't stop there. We packaged those devices. Can you stop there? No, you cannot. We built the systems. Now the government is listening, and they asked us to come up with a detailed project report, which is due now. Next week it is going, with an idea of creating a gallium nitride foundry in the country, right? So this is how you should sort of really look at the future, right? And the deep tech and visionary research can really lead to this. Okay, now let me switch on the startup, right? This one startup I will spend next few minutes has been an exciting journey for me, right? We have this startup, we call it Path Shodh. A lot of people read it Path Shodh. We don't mind that. And this is another example of science to product journey. How did it start? Firstly, what is it all about? This is all about what we call point of care diagnostics, okay? It's a multi and interdisciplinary research. Only when you have facilities like what I showed, you can do that, okay? And why? You see, if you want to really do a revolutionary product, you need to do a lot of research in chemistry, biology, electronics, and manufacturing. Only then you get a point of care diagnostic, which doesn't exist. We are not talking about glucometers. The core requirement then is a scientific discovery which is essential for any deep tech product, leading to engineering innovation, technology development, manufacturing scale up. Otherwise, you will not really sell these products. Is that sufficient? No, it is not. You need what are called soft skills. You need out of the box thinking, team building, perseverance and patience, which we had learned anyway while creating the center, and of course, business acumen, right? I mean, people think that, hey, professors don't have any business acumen. Maybe that's not really true, okay? When we do all this right, we can create first of its kind revolutionary product in the world which does not exist anywhere else in the world. Ladies and gentlemen, I'm very proud to present to you what we call Anupath. And we are very proud of even naming this with Indian names. Anupath stands for molecular diagnostics. This device, we say it's not just made in India, it's invented, developed, and manufactured in India, right? It is the only device in the world which can do 8 tests, 5 blood tests and 3 urine tests on a single device using disposable strips. Nowhere else in the world. Okay, I will tell you why did we do that in a minute, right? So this can happen. This can happen. An academic research leading to a product. We are talking about creating Googles of tomorrow. I mean, how can it happen unless you have a deep research and deep tech? This use, by the way, makes use of what we call a custom disposable strip, like a glucometer strips, right? And you will be able to do all this, right? Why did we do that? Again, 10 years ago, I started thinking about it, right? Now everybody talks of diabetes. Diabetes management, I think, is a challenge for this century. And it's really a metabolic disorder. Diabetes itself is not a big thing, but it's a complication of diabetes that's a big, big killer. It affects almost every part of the body, every part of the human body. Okay, and I don't need to tell you, there was an article published in Lancet. It said, India is a diabetes capital of world, and diabetes spend is 5 times the healthcare spend in the country. Can you imagine that? Again, I'm an electronics engineer. What was my motivation? It's a very interesting feedback control system, right? Which has gone amok when you have this diabetes, right? And I started looking at it way back in 2005. Okay, started some initial work, got some funding. This is different from the funding I was talking about for the Nano Center. And we also had a first PhD student. He graduated. We got a US patent. So far, so good. Now I have a theory. If you want to create products based on deep tech, you need 2 generations of PhD students. Not 1 generation, 2 generations of PhD students. So we had done that, lot of lingering questions, right? So what do we do from there? So I had to recruit 1 more PhD student, right? And that is when the idea of Path Shod started. This gentleman, I also want to spend a minute on this. I recruited Vinay way back in 2012 as a project associate, not for PhD. I mean, this is just to sort of tell you that talent is everywhere in the country. I mean, don't just look at IITs and IISc, right? We need large number of people. This fellow comes from a remote village in UP, who was diagnosed with diabetes when he was 14 years of age, juvenile diabetic. Till today, he has had several tens of thousands of pricks on his body, but did not lose hope. He was the first graduate from his village. That was enough for me to get this guy. It was not important for me to get an IIT graduate. I said, he was also working in Delhi, actually Noida, in a VLSI chip design company after completing his MTech from Kurukshetra University. But he was really tired of diabetes, right? And I said, come on, let's start doing something, right? He came on board and he registered for his PhD in 2013. He had his own dreams, wanted to do something, but I said, no, this is what you have to do, right? And of course, it's not that it's a forceful, it's through a discussion. Nothing forceful happens, at least in our center. But that led to cascade of events. I'll come to that in a minute. And we registered this company in 2015, July 2015. And I took a year off, sabbatical leave for a year, because unless you really put all your efforts in that, things would not happen, right? I said, okay, I will take a year off, come with you, and let's get this going. Okay, so started my sabbatical leave in September. Just last week I joined back institute. You know, we also had startups from IIC Vijay Chandru days, but they had to go out completely. Or there were also startup examples where faculty were there part time, they were spending with the startups. But this doesn't happen in Stanford, or any other US universities. Faculty go out for a year, start a company, come back and start looking at new technologies, right? So this perhaps is the first such instance in IISc, right? So we wanted to innovate a new paradigm in diabetes management. What was that? Everybody knows glucometers, right? It gives you instant blood sugar. But you can fool the doctors with, before going to the test, people just previous day, you stop taking sugar and all that. So your, sugar comes very well when you go to the doctor, right? And it is very well recognized today that mere glucose testing is nothing for diabetes treatment. It is insufficient. Very interestingly, physicians of Indian, there's a society, they had conducted a research survey which said more than 80% of people with diabetes in India feel that their diabetes is under control based on the glucose measurement, while the facts suggest completely otherwise. Their diabetes is not under control. So what do you do? Fortunately, God has created a lot of other interesting molecules in our body. One such molecule is called HbA1c, glycated hemoglobin. You can not fool a doctor because this is an integrator in your body. Glycated hemoglobin gives 2 to 3 months average blood sugar in your body. And it has been well documented from studies all over the world that complications of the diabetes are an exponential function of A1C value. Complications such as kidney failure, heart failure, and so on and so forth. The target value is to maintain HbA1c at less than 6.5%. HbA1c just means that part of your hemoglobin has been converted into a new compound which is called glycosylated hemoglobin. It's a combination of hemoglobin and glucose. If you have more glucose, you also have more glycosylated hemoglobin, right? So we said, okay, let's think about a device which not only does glucose, also does glycated hemoglobin. Is that sufficient? No, it is not. Why? Because doctor cannot wait. Doctor starts medicine. He cannot wait for 2 to 3 months to see whether the medicine is working. You need a quick decision. Glucose is not good enough. There is a new kid on the block called glycated albumin. This is very interesting. This is pioneered only in Japan as of today. Albumin is another plasma protein. It has a half-life of 14 days. Yes, I'll get done in 5 minutes. So, if you can measure glycated fraction of albumin, you get 2 weeks average blood sugar in your body. How great it would be to have an instantaneous blood glucose, 2 weeks average blood glucose, and 2 to 3 months average blood glucose, all in a point of care device. You know what? This glycated albumin is also important in other complications such as chronic kidney disease, gestational diabetes, where you cannot wait for glycated hemoglobin. It takes 3 months. Your pregnancy itself is 9 months, right? The fact of the matter is, even the top pathology labs today, let alone a handheld device, top pathology labs in the country cannot do glycated albumin because reagents are so expensive. We said, okay, why don't we do it on a handheld device? Can we do it? Right? And there are a lot of advantages because of that. And we said, let's not stop there. Let's also have this device as a platform device. It can be extended in future, but to begin with, let's show that this platform works. Let's also do 3 urine tests with that, which is one of the important complications of diabetes. Microalbuminuria, creatinine in urine, and albumin to creatinine ratio. Now we have a device which can do all this in one device. How did we do that? This is where you need out-of-the-box thinking. I mean, it is not that someone else has done that, you copy it and you get that. No, it will not work, right? So, glucometer, it uses what is called an electrochemical sensing technology. the bottom line is that there is what is called a redox current. I will not go into too many technical details. You measure the amount of current that is proportional to an analyte. It's done for a glucose sensing. Glucose oxidase is an enzyme that is used in all these sensor strips. You know, but there is a harsh reality we have to face. Glucose came on board in 80s. The idea was proposed in 1960s by Professor Clark. Biosensor publication has grown exponentially, and market is huge today. But we have to face this harsh reality. Predominantly, the market is only glucose sensor, and we are stuck there. Why? Why are we stuck there? Why can't we do other tests like this? Because a lot of people have articulated this. This is a Royal Society of Chemistry publication. I just want to highlight this. There is a bottleneck in biosensor research, right? In the fundamental understanding of biorecognition macromolecules. This is why we have not succeeded. We decided to take this head on, right? And it takes time to come up with such research, right? But we did, right? And we wanted to change the paradigm, right? If you look at the pathology labs, just as computers have evolved, pathology labs have also evolved, right? From early 1900s to what we have, they all use autoanalyzers in these well-controlled conditions. They can use antibodies, enzymes, everything, because conditions are very well maintained. But biosensor is a different beast. If you look at the International Union of Pure and Applied Chemistry, it clearly states biosensor is different from autoanalyzers used in pathology labs. It's an integrated receptor transducer device, right? And you have an analyte, you get a signal, right? Accuracy and efficiency is extremely important here. And how does accuracy come? Because of the specificity of receptor that you are designing, right? If you have because biofluid has a lot of molecules, you need to just get one molecule and say what is the concentration of that, right? And once you get the specificity of the receptor, you need to produce a signal, and then you have a sensor. There are different ways of doing this, and as I said, historically it is enzymes, antibodies, and that's it, right? We said we don't want to use that. Let's focus on some specific ligands and chemical receptors, and focus on electrochemical sensing technology, right? And let's fast forward to October 2016, right? That's a company that we have with lots of interesting facilities out there. Very conscious, we are very conscious. Don't think that academicians are not conscious about IP protection. We have more than 7 international patents filed, 4 more are in pipeline, right? Because we are very, very conscious on how to protect the IPs, right? And our device itself went through multiple iterations, right? Because this is where user experience and all that is extremely important. And the real business is not in device, it's in consumables, right? Our test strip also went through whole range of iteration, right? And eventually now we have a sort of a pilot line set up here in IAC, where we are able to do sort of this manufacturing at a scale, okay? Both the handheld device as well as the test strip that we have. So this would not have happened but for this exciting team, a great team that I've been able to put together. Now, ladies and gentlemen, it's time to dispel some myths here, right? So the general perception, this was raised by one of the gentlemen immediately after Chris Gopalkrishnan gave his talk. Academic institute, and in particular IISc. IISc is a science, doesn't work on technology. No. Times have changed. And does not develop product. No, not at all. Not at all. Right? Right. So, I think, it has gone to a previous version of the slides, but it's okay. There were a few more things that I had, but we do all these things. We do research, we do technology development, we do industry collaboration, we do create startups, we do create products. All that can be done. I mean, times have changed. The change is in the air, and the change is here to stay, right? So I think, we really have to move forward. Bygones are gone, right? We shouldn't really worry about the history. We have a great opportunity to go forward, and, I think together we can do it, right? Thank you for your attention.
morning, everybody. Good morning, sir. Let me introduce myself. I'm Srinivas. Last 14 years, I was with industry. My last employer was Cisco, and currently, from last 4 years, I'm an academician. So the concern that I see is academicians, we have a lack of where to go next. You talked about startups, products, and all. Every year, there are so many students, so many projects come out at the end of the year, but they die there only. As soon as the exam Viva is over, they all are put to recycle bin. So the question that I have is, we need some path, or we need some policies, or we need some way to tell, if you have some ideas, this is a forum, please come and showcase us. That is what I'm looking.
Right,
Thank you, sir.
absolutely, absolutely. As I already mentioned, times have changed and times are changing. Now, startup are the well-defined policy of the government of India, right? Startup India is the slogan, right? And even Karnataka government has this new, new age startup network or something. I think the ecosystem is just right, right? Academicians, industry, everybody, as I said, should move from their known position. That is what is required today, right? Yeah. We need to accept changes and we need to be open at the end of the day.